Good evening from New York. I'm Chris Hayes. As U.S. coronavirus cases cross 42,000, we've now become the country with the second highest recorded active cases, headed, it seems, unfortunately, towards number one. And at this moment, President Trump is very obviously indecisive and losing his nerve. And millions of lives are on the line because of it. Remember, we are here in this frightening situation because in the 2 months the U.S. and the White House had to prepare for the virus, the president was concerned about the economy and the stock market and chiefly his own re-election chances. Less than a month ago, he told us the virus was going to, quote, disappear. Just 17 days ago, his top economic advisor said the virus looks relatively contained. The administration did not get adequate personal protective equipment for medical professionals like masks and gloves and gowns. They ignored explicit warnings about shortages of those things, of ventilators and other medical supplies. They did not do adequate testing. They created a test that didn't work, stopped other people from pursuing their own, and the result is that the United States has been the international laggard in testing. We are ramping up finally now. All of that combined allowed for what is one of the worst outbreaks in the world in terms of the rate of growth, if not the worst.
At the president's press conference today, he said, our country wasn't built to be shut down. He said normal life will return soon. He seems to be suggesting that these social distancing measures that we're taking should be relieved sometime soon. Just have to ask how that landed with you.
That landed pretty poorly. I cannot emphasize enough how important social distancing is right now. So when you stay apart from people, you prevent the transmission of the virus. We know from Italy that it is starting to work. There's preliminary data out of San Francisco under Governor Gavin Newsom's direction that they're starting to see a decrease in the number of new cases because they put social distancing in place early. We know that it takes about 2 weeks for the virus to show up, so maintaining that distance now is absolutely critical. And here's the thing, it matters not just because I don't want people to be infected by COVID-19, but it also matters because if my emergency department is full of critically ill patients with COVID-19, I'm not going to have the resources to take care of appendicitis or a car crash or a heart attack. Now, again, my hospital system is preparing for these eventualities, but nationwide, we're gonna be overwhelmed and we're not gonna be able to take care of the everyday emergencies that folks have, whether or not there's a pandemic out there. So social distancing is just critical. Now is not the time to say that we're done with it.
And they just feel like it's way too soon to reopen schools, businesses, restaurants, that we really need to get this under control. And the other point that the public health officials make is that there's still really a scarcity of testing in the U.S. And so it's very difficult to even know who is positive and who should be isolated. And until that testing problem is solved, the public health officials within the administration feel like this is a very irresponsible choice.
I don't hold out much hope for federal orders because the president is seeming to have a hard time believing in this germ. What he's talking about, at 15 days the doors are open, is like, having a lead-lined room next to the Chernobyl power plant, and you fling open the doors and say, hey, the flowers are still sprouting out there. It's a sunny day. I think it's okay to go out. It's not okay to go out. There are things that you haven't seen yet because so many people are getting infected, but they're not going to be hospitalized for, on average, another 10 days after they show symptoms. It's only going to be forced home in the same way that AIDS was forced home to Ronald Reagan after 4 years of not mentioning it by the death of his friend Rock Hudson. Something's going to have to wake the president up to the realization that this is a very serious danger, including to him and his family, and being cavalier about it in order to save your 401k is probably a short-term good with really bad long-term consequences.
America will again and soon be open for business, very soon, a lot sooner than 3 or 4 months that somebody was suggesting, a lot sooner. We cannot let the cure be worse than the problem.
The problem for Donald Trump is that he's not in charge of this one. Donald Trump has not closed down anything inside the United States. Donald Trump has not closed a single business in this country, not a single school. He hasn't closed anything. It's America's mayors and county officials and governors who have done that. Mostly the governors. The governors of New York and California have both closed down their states, and there is nothing Donald Trump can do about that. The governors of New York and California control more economic activity combined than most of the rest of the United States of America put together. And they are not going to reopen their states because of anything that Donald Trump says. Donald Trump didn't shut down anything, and so Donald Trump cannot reopen anything. Donald Trump is not in charge here. The governors are in charge. And that is good news. And that includes Republican governors who have shut down their states.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.